So our next case is not motion preservation. It's a patient that has 2 levels of pathology, collapse at L4-5 with a lot of erosive bony changes on the end plate and big gnarly arthritic facet joints, both at L4-5 and L3-4. So as much as I love doing motion preservation, there are times when the technology presently in 2025 doesn't fit that. Now, 5 or 10 years from now, the story may be different. So right now, what we're going to do is minimally invasive laminectomy, combined interbody and posterior fusion. We use an interbody device, also known as a cage, and then rods and screws. This will not be motion sparing. This is a patient that's pretty much bone on bone. It's a very irregular, eroded end plate, herniated disc at 4-5. I'm on a 3-4 with it. That white dot there is a tear in the annulus. This is the cross section, or we call axial view, and this is actually the tear in the disc, the covering of the disc of the annulus. So that can be very, very painful. So this will not be a motion preservation case. This patient has a lot of axial back pain, so pain that comes right down the center of the spine. Decompression without some kind of stabilization, and the stabilization could either be with a disc replacement or a fusion. Here, a disc replacement would not be appropriate, particularly because of the destruction of the end plates and because the facets are a bit hypertrophied here. You see them here. And so you'd be putting a disc replacement into a stenotic area, and that doesn't usually work, and the facets are already arthritic. So this is a case that in 2025 would be a laminectomy with a fusion. So this is our 2D. That looks great. Our 3D also. It's our lateral, so this should help this patient a lot.